Facelift secrets that nobody tells you about. Dr. Noel, or Madame Noel, is a French plastic surgeon who taught us how to do facelifts in the early 1920s. And her and her colleagues in Paris developed these techniques in doing the early facelifts. We kept doing these facelifts until 1976, when another two famous Parisian plastic surgeons, Mitz and Peroni, taught us that there's a layer right under the skin called a smash. And that layer carries some of the fat, carries some of the volume, and they taught us that if you shape that layer, you can get some very nice results in facelifting. And then Torch Cook, a Swedish plastic surgeon, in 1978 designed what became now the foundation of most facelifts, including deep plane facelift and all that stuff. So since 1978, we have been doing a variation of what Dr. Skug has been doing. And the key for a good result is choosing the correct procedure for each patient. All these procedures work very nice. All these techniques work very nice. And we have proved this at the American Society of Plastic Surgeons by doing the twin study. You can easily Google twin study, facelift, American Society of Plastic Surgeons, and you'll see what I'm talking about. Now, what makes the patient happy and what makes the surgeon happy is choosing the appropriate technique for the appropriate anatomy. When you do that, really amazing things happen. So if someone has very low volume in the cheeks with a very thin face, you do something to work on that. When someone has a full face, round, full face, you do something else. If a patient has a lot of no definition or mal-definition of the jawline, you do another procedure. So, and of course, this in addition to the course of platysmoplasty, which has become my standard go-to procedure for the platysma bands and for the neck. This was developed by Joel Feldman, Dr. Joel Feldman in Massachusetts. So the take-home message is the surgeon has so many tools that he can use or she can use to use for the appropriate anatomy that the patient has. The better results are obtained when the appropriate technique is used for the individual patient. That's why on my website or in our social media, you will never find two patients who look the same. Why? Because every eVlift is designed or tailored to the needs of the patient's aging anatomy. And that's it. Thank you.